barriers tell us about how we should be diagnosing the disease? Do we need to become a bit more like France in recognition of alternative symptoms? Professor Nirmal Kumar is a consultant ear, nose and throat surgeon. Do you believe, Professor Kumar, that we have to change the guidelines in how we recognise symptoms? Is that important?
Yes, we strongly believe that, because the sudden loss of the sense of smell is something that we are seeing in a huge number of patients with COVID-19, almost a third to two-thirds of patients, and in particular, the younger patients who are otherwise well, who have almost no other symptoms and sometimes very mild symptoms, are presenting with the sudden loss of smell and the associated loss of taste. And this is something that will allow us to improve the containment if we encourage these people to self-isolate for this usual 7 days and reduce the spread and containment of this virus in the community.
Does the symptom give any indication of how the virus will develop, i.e. is the loss of smell and taste going to lead to a less dangerous form of the virus?
It seems so. That's very early to say for certain, but the large number of patients in whom this happens are these young, fit people who otherwise get on with their lives, and unfortunately they are not aware of the need to self-isolate because it's not there in current guidance, and therefore there is more of a spread happening. And yes, it's certainly true that it's much commoner in the young and middle-aged working population rather than the so-called vulnerable and elderly people.
What do you believe has been lost by ignoring these symptoms thus far? I know I mentioned France. I think that has a different way of saying, if you show any of these symptoms, go away, take 2 days off work, see how they sort of progress, if you like, before you come back. Is there a midway between, recognising the symptoms and actually a proper lockdown of isolation for 7 or 14 days?
Absolutely. I think it is essential, because when these patients suddenly lose the sense of smell, this is not something we have seen before. We've all seen the common cold where they have a nasal blockage or other symptoms, but the sudden loss of sense of smell should be a red herring or a warning for us to self-isolate early and then prevent that spread, because that's part of the containment policy that we are trying to enforce. And this is lost completely if even the key workers and others are carrying on with their normal lives without isolating.
Professor Kumar, I know that you recently